Hey guys, so recently I had multiple ER visits because I am unable to meet my basic needs. I'm having trouble sleeping tonight because, for one, I've been sleeping way too much for my skin infection, haven't been feeling well, on antibiotics, feeling much better. And I think I had too much sleep, too much. I do gotta sleep because sleep is very important. However, this is not fair for me. I'm very smart, and he needs help. Can you please take a look at this? This is important. We'll share with you. Sorry. I'll share with you a little bit later what I'm going through and what I'm trying to get done. However, I'm going to try to play this video, get some sleep, because I need it to help me with my emotional health and frustration tolerance. I just having a little bit of stomach pain from the antibiotics I'm taking. Nobody told me if I'm supposed to take one of the antibiotics or two, or if Andy's supposed to take, the two together, or continue the cream. It's just, nobody's really explained this stuff to me. So it's taking two antibiotics together with the antibiotic cream. And the antibiotic cream is clindamycin, and the medication pill, one of the medication pills for antibiotic is clindamycin. It's frustrating. I'm trying to be independent, trying to be able to take care of me, and he's trying to clean, trying to do things. Last week was an off week for me because of way too many appointments. I'm going to play this recording for you guys and want to see your opinions on this, because I'm starting a bunch of videos of legal rights to those who are developmentally disabled, legal accommodations, reasonable accommodations, and what you should do and should not do to somebody with a developmental disability, learning disability, or autism, anxiety disorder, depression. This is what I'm going to be trying to help you guys with, so this doesn't happen to the next person. I'm redirecting my focus into educating people rather than telling them what to do, what not to do, or to call them out. Going to be putting out some videos of private phone calls and things like that, not to show them, hey, this is what you did, call them out, but to teach you guys that's not the right way of doing it. So we'd like to share with you guys with this here, and I'd like to try to take my friend Doug, the CEO of Independent Living Center, suggestion in teaching people about autism and how I live with it and what struggles with me. I'll get to that in a minute, what it feels like, what it is, what I struggle with, and show you guys what I'm going through. And I like to show you guys a lot of things because it's been a really rough ride for me. I'm very smart, very knowledgeable in facts. This is just a bunch of videos that I've already watched in the past. This is one of them. There's social service laws, the mental legal hygiene laws, Department of Health laws, rules and regulations for state and federal employees, there hospital laws and rights, and Medicare rights, and the unconstitutional law that protects people's rights with Medicare and medical insurance and medical care, the Affordable Care Act under Obama. That was done illegally. However, a lot of the unconstitutional laws should be preventing people like me, or those are seniors, to be discharged unlawfully to unsafe, unsupervised, unstructured living environment without having services in place before the discharge. And he has no one to assist me because I'm homeless, because Adult Protective Services has mishandled my funds and mishandled my care. They claimed I'm purposely doing this stuff and misrepresenting my disability and medical claims and things like that. However, I am not, and I have Independent Living Center who's really helping me. Going to show you some of the comments that I'm going through back and forth with this here. This is not at all to call out anybody from this point on. This is to educate people how to help me, how to work with somebody with a severe, I would call myself severe with the expressive language, receptive language part, because I'm not doing this to be bad, not doing this to be good, not doing this to be any way. I want to be good, following rules and things like that. I want to share with you, I want to stick to the topic on here, what I have trouble with doing. I have trouble cleaning, mostly organizing. I can clean pretty much anything for dirt. Very good at it. Very good at cleaning dishes. However, sensory problems come into play. Certain chemicals bother me, like Lysol bothers me. Rather deal with bleach products, believe it or don't. Pine salt is another good chemical for me. So certain degreasers and sanitize solutions that you would use at a restaurant would actually work for me too. However, Lysol in itself gags me. The feel of the Lysol on a sponge bothers me because it gets all sudsy. It's like using Pledge on a paper towel without really using a bunch of paper towels to get the full effects of, being a clean and dust. Using a vacuum cleaner I can tolerate to a certain extent, preferably with earmuffs. I also struggle organizing. It's the planning, it's the sorting by like-kind items. Look, I can tell you right now, what is a piece of paper from another piece of paper? You put those together. What is a shirt and what is a pant? You put them separate. You put another pair of pants and a shirt with the like-kind item. The shirt with a shirt, pant with a pant. The issue I have is when you have a room, and I learned this with my a lot of YouTube stuff, and my friend Julie was actually quite praising me for recognizing, hey, it's easier to take all the shirts, put them all together with the shirts, then go to the pants and do the pants. Do all the papers in the room and organize it by that paper. That was much easier for me. I learned that on my own. YouTube videos and some of the things that my friend Julie was working on was hard for me to do that. Because they just went around in one area of the room. Of course, their room didn't look as bad as mine. And got the different items and put them in different categories. By its kind, color, shape, size, you name it. Document type priority, you name it. Here's the thing I want to share with you guys. I have trouble with hygiene. It's not that I don't know how to shower. It's more the sensory problem in the shower. A bathtub is much easier for me to take care of myself. Plus, it's relaxing. Trouble taking my medication properly and efficiently. Even with my alarm set up on my phone, I try. Cutting my fingernails bother me because it hurts me when I cut my fingernails. It's also hard for my hands to move with my left hand. Shaving bothers me. I rather use a regular Gillette Fusion razor or Gillette Mach 4 razor to get my the close shave, and it doesn't really have the sensory problems. However, those are too expensive for me, and every other shaver I use, I just don't know how to do it properly. So I had to use this electric razor that bothers my sensory problem. I have trouble tying my sneakers and sweatpants, but it isn't that I don't know how to do that. It just struggles. I can do it. It's just my hand that moves an awkward way. I can move. I have trouble making my bed with that elastic bottom sheet. I always call it bottom sheet, top sheet. Mom said it's a fitted sheet. I don't know why I call it the top sheet, bottom sheet, even though I know the technical name. So the fitted sheet with the elastics, I have trouble putting on my bed. It isn't I don't know how to do it. Give me a little assistance. I can do it with you. Putting the flat sheet on my bed, tucking it all around each side, that's much easier for me to do. And it's actually, it's also more work though. But I can do it. A lot easier. Cooking. I can cook. I need help being safe. Help me protect myself from burning myself, burning others, starting a fire, sensory support, and multitasking. When there's more than one ingredient going involved and more than one food, I struggle. It's not that I don't know how to do it. It's the multi-step and safety concern sensory problem. When it comes to, proper food storage, I know how to do that. However, the fridge I have right now, there's not a good way organizing with my diet. So, technically, you should not have lettuce products on the bottom shelf and have lunch meat on the top shelf. I understand you should have it the reverse way. However, there's no other way in my fridge to work it because if Andy puts the lettuce on the top shelf, it freezes. Or bottom shelf, rather, it freezes. Top shelf, it freezes. However, if you put it in a certain area on the top shelf, it doesn't freeze. You put it on the bottom shelf, it freezes. And it's like, where the heck does it get cold? Why is it so cold? It's like, it's on 1. It's actually below 1. Don't know what's wrong with this fridge. It's super cold. And it annoys me because I go through lettuce and I like lettuce. Like eating salads. Then there is, using a microwave. The number one thing I've caused issues with fires. Popcorn. Like microwave meals. Things like that I struggle with. It isn't that I don't know how to use a microwave. It's the fire safety. I know what to do with you basically stop the microwave. You don't open the microwave door. You just stop it. You press the cancel button. It goes right out. Unless you did something totally stupid and overcooked popcorn, then you have an issue there. Wow. Don't ever do that. The other thing is getting out in an emergency. I struggle with it. I've been told by one of my friends, getting out of your room, you should feel the door to go out. I never really thought about doing that. When the smoke alarm goes off, I can't even think in that moment. I know how to fight a fire, sort of, not trained, but my nephew, Nathan Tamlin, taught me how to do it. I know how to use a fire, I would never even think of doing it. Let alone, I know how to use a fire extinguisher. You pull the pin, you aim at the base of the flame, and you go from left to right, from the base to its top point. And if it gets towards a wall or something, you get out. However, in that time of moment, you got smoke, you got the flame, you got the noise of smoke alarm. Sometimes the flame may be making noise. You got the fire extinguisher that makes a noise. And then anxiety. I can't do. I know how to, cross a street. It's a sensory problem. However, Mom made a comment when I talked to her last night about how to cross the street because apparently I'm not doing it right. I'm like, Mom, that was the easiest part on the autism assessment in school, crossing the street. It was the easiest one. I told her, I know how to boil hard-boiled eggs. You put it in a cupcake pan, individual cupcake pans, and you put it in the oven. However, how long you cook it for, or how, hot it gets, I don't know. Tell me the boiling egg theory, I don't know how to do it properly. I can scrambled eggs. I can over easy eggs, but that's hard. I want to play this video because this person is basically something what I'm going through. My room's a mess. I struggle taking care of myself. I'm trying. It is just way too much, and I want to play this for you guys.
Self-neglect is a serious and growing health concern. It's the most common form of elder abuse reported to Adult Protective Services. Research has found that older people with self-neglect have a 5-fold increase in death if not addressed. Veterans with dementia are at a higher risk, especially those who live alone. As providers, we must be aware of the warning signs of self-neglect. A team approach is recommended to bring insight and resources into treating this complex situation.
Hey, Latasha, thanks for meeting me. I appreciate it. All right, before we go meet with Mr. Garcia, I'd like to fill you in with some more details.
Sure, no problem.
All right, as you know, late last night he was admitted for diabetic ketoacidosis and uncontrolled hypertension. A neighbor had checked on him and then called 911.
Right, and you said when EMS arrived, he didn't know his name, was really confused, and his place was very messy.
The EMS reports that his home was in deplorable condition and there was trash everywhere, a horrible smell, and no food in the fridge.
Does he live alone?
Yes, a neighbor checks in on him. At first, Mr. Garcia didn't want to come to the ER, but after considerable coaching, he did agree.
Anything else?
Oh, yeah. Recently, he was diagnosed with dementia, and I'm afraid that he's unable to take care of himself.
This seems like a situation that'll take more than one person to tackle. If you're ready, we can get started.
Let's go.
Hey, you really had me scared. I'm really glad you agreed to come in, because you are looking better already.
Oh, boy. I can't remember anything.
Hello, Mr. Garcia. My name is Mr. Sargent. I'm a physician's assistant. This is Miss Jackson. She's your social worker. We work with Dr. Reed on your team.
Nice to meet you.
Hi, this is Jude, my neighbor.
Oh, Jude.
Hi.
Hey, thank you very much for getting Mr. Garcia to the hospital.
Yeah, sure. I'm glad to help.
Good deal. Mr. Garcia, would you prefer if we meet with you alone?
No, Jude can stay. He's a close friend.
Okay, great. Wonderful. How you feeling today, Mr. Garcia?
Oh, I'm all right. I've had better days.
The team observes a disheveled appearance. Veteran's hair and beard are overgrown. He is pale. There's obvious dirt underneath his nails.
Mr. Garcia, you were hospitalized last night because your blood sugar level and your blood pressure were really high. What I'd like to do is ask you a few questions about your medications. Are you having any trouble with any of them?
I take them when I remember, and I'm pretty sure I'm out of one of them.
Do you know which one?
I think it's a white one.
Are there any other problems with any of your other medications?
Yeah, I hate the one with the needle. It's so small, and it's hard to see the little lines on the syringe. It's just too much work.
Can you tell me the last time that you've taken your medicines?
I'm really not sure.
I see. Looks like you said you're having difficulty keeping track of your medicines.
Can I ask about your family and friends?
Well, I live alone. My wife died a long time ago. Most of my brother and sisters are gone too. My children haven't visited in years. There's really no one.
What about Jude?
Oh, yeah, I've got Jude. We've been friends for a while. He's the one that got me to come here. But, you know, I don't need much help. I manage okay on my own.
Well, other than your neighbor, do you have any other friends that drop by?
Oh, just me. Most of my friends are gone or moved away. But hey, why are you asking me all this stuff?
I know it seems like we're being nosy, but we're asking these questions because we're trying to make sure you're living in a safe place and that you can manage your medications.
Well, it may not be easy, but my house is where I want to be.
Well, that's good to know. I've noticed in your charts that you've lost quite a bit of weight.
So, first of all, I'd like to really pinpoint this here. Never had a hospital ever do this kind of work for me. They never sat down. They never, asked all these detailed questions. They just claim, oh, you have help. There's no need for a hospital stay. Really? You're going to tell me right now, not be able to take care of your medications properly, doing much better at it up until last week, when didn't have the medications I needed. I had, made a comment throughout my medicines to one day. However, I went out to the garbage tote to get it, because Andy kind of knew my issue was with my payee, not going to get my medicines. I got it the same day. However, I threw it out because of a choice of acting on impulse, of overdosing in the last two of the 3 times I did it, I really got sick. The last 2 times. I'll never do it. I really don't want to feel that way. I don't like being sick. I don't like it. I'd rather be in my own home. Rather be independent. However, nobody's really worked on these skills with me. I'm struggling just to be able to take care, organize my room a little bit right now, and I was going to do some dishes and then get to bed, but I'm also struggling to be able to put things in order. Like, just putting away my clothes, I had a bunch of water bottles in the bags that had to go back to the store, and I just unable to do that. So I'm going to go ahead and finish this here. This is how you properly treat somebody like me. You ask questions, you get to know them. My independent living center worker told doctors it's unsafe, it is self-neglect, it is neglect of the county that should be helping me. We're going to get to that in a minute. However, I don't think that was really appropriate for my independent living center worker to be stating that in front of me. However, I already kind of knew it.
Can you tell me how many meals you're eating a day?
I eat when I get hungry. A couple of times a day, maybe.
How do you get your food? Do you have any problems getting groceries?
Jude gets food for me a couple of times a month. I just tell him what I need.
That's not real often. Do you ever run out of food?
No. I just make it last until he can get me some more.
Mr. Sargent and Ms. Jackson are very concerned. Veterans with dementia, especially those living alone and socially isolated, are at great risk for self-neglect. This veteran is exhibiting several red flags of self-neglect, including a diagnosis of dementia, difficulties with activities of independent living, such as shopping and meal preparation, poor personal hygiene, inability to manage his own medications, and almost no social support.
Oh, I have no social support. It takes an arm and a leg of a battle to get help from my dad to be able to help me get food or to pay for my needs because my payee refused to help me. So glad that's done over with. Then there are issues of, basically managing my own medicines, hygiene. Pretty much the same thing this guy is going for. However, the difference between him and me, I have autism. Autism's not dementia. It's a learning disability that affects my sensory and be able to learn and communicate. This person here, he's getting the treatment that should be done. I have no one other than my dad. There's no friends that associate with me or willing to help me. There's no one. And here's the thing. I want friends. I'm not a dangerous person. Would love to hang out with people to help me shop, clean, take care of myself. But I don't have that person. I'm here to show you guys how to interact with somebody like me. And I'm going to share with you guys a few tips. How to make my life easier and less stressful and less acting out. In your life a little bit easier in dealing with somebody like me with a language impairment. And I'll get to that in a minute.
In some cases, it's a good idea to meet with family or friends who are familiar with the veteran to better understand the veteran situation.
Mr. Garcia, do you mind if we ask Jude a few questions to get a better understanding?
Sure, I have nothing to hide.
Thank you again for being here for your neighbor. Do you help Mr. Garcia with his medicines?
Well, I ask him if he's taking them, and, most of the time he says he doesn't need them because there's nothing wrong with them. And also it can get pretty confusing, keeping track of the medication because some of the bottles will have a bunch of different kind of pills in them.
Anything else?
Sometimes when I'm trying to help him with his medication, he'll accuse me of trying to poison him.
I see.
Can you tell us how he's able to keep up things around the house?
Well, it can be pretty much of a wreck in there, I try to pick up when I can, but he didn't like that either.
Can you describe his home to us?
Well, I just got back yesterday. I've been gone about 3 weeks. And, hey, now listen. Okay, you don't get mad at me, all right? 'Cause I got to tell him about yesterday, okay? Things were pretty bad in there when I went to check on him here. I actually took some pictures with my cell phone that I can show you.
What the heck? Are you trying to make me look like I can't take care of myself? No way. No, I know what you're thinking, and I'm not leaving my home. No.
Manuel.
No.
You need some help.
No.
I see you're upset. Let's take a break.
I'm not.
We're going to step out for a second.
Jude, I'm not leaving my home. I'm not. I don't care what they say. I'm not going
Manuel,
anywhere.
you
I'm
need
not.
some help. I'm worried about you there.
I am really concerned about Mr. Garcia. I see so many red flags for self-neglect. He has dementia. He's of advanced age. He lives alone and in terrible conditions. I don't think he's able to take care of himself or manage his medications. His only source of support is Jude.
I agree. Can you imagine if Jude wasn't there? I mean, do you think that he's safe to live alone?
Certainly not without help. While he's an inpatient, we're going to need to develop a plan for Mr. Garcia that allows him to be as safe and as independent as possible. A referral to Adult Protective Services will be needed.
All right, well, let's go back in, share our thoughts with Mr. Garcia, and I'll update Dr. Reed. All right.
Our scenario has highlighted some of the risk factors for self-neglect. The more common ones include advanced age, cognitive impairment including dementia, frontal lobe dysfunction, depression, social isolation and lack of support, and nutritional deficiency. As seen in Mr. Garcia's case, self-neglect presents with warning signs. The more common ones include refusal of medical treatments, failure to take medications, having undiagnosed conditions, dehydration and poor nutrition, poor hygiene, wearing clothing inappropriate for the weather, and living in unsafe conditions, including signs of hoarding. Self-neglect is a serious condition and potentially fatal. A thoughtful, compassionate, and interdisciplinary approach is necessary to address the complexities of self-neglect. Knowing the red flags and the right questions to ask will ensure the safety and well-being of the veteran.
Okay, guys, some of you guys may be like, why are you cleaning at 5 o'clock in the morning? 6 o'clock in the morning? Didn't you sleep all night? The answer is no. I had a stomach ache. It's now a little warm in my room. I'm going to turn the air. But I don't think you guys understand. I slept almost like 7 days straight. I wasn't feeling well. I'll show you in a second. So this is my doctor's discharge. I got upset with him. And I don't mean to, because Sean Campbell's very nice. I trust him a lot. However, there's a time and a place where I don't feel my needs are being met at all. This is my emergency room admit where I was discharged. And I'll get to these in a minute. Maybe I'll do this in a new video.